Are you suffering from severe knee pain and arthritis? Wondering about the right age for knee replacement surgery? Curious about the best doctors and hospital facilities? Or are you concerned about the cost? If you're considering knee replacement surgery for yourself or your loved one, well, you are in the right place. Knee replacement surgery is a procedure that involves resurfacing a damaged knee due to arthritis.
I am Dr. IPS Oberoi. I am Director Arthroscopy and Joint Replacement at Vaidam Health Institute, Gurgaon, India. Knee joint replacement does not mean that you cut the knee and put a new knee inside. It essentially means that we open the joint, clean the joint from inside and put a new cap. A special cap is put both on femur and the tibia. These caps reduce the friction inside the joint, give full mobility to the patients, and patient is able to stand and start walking within 24 to 48 hours.
In this surgical procedure, plastic and metal implants are used, which cover the ends of the bones that makes up the knee joint, including the knee cap. The different types of knee implants include metal on plastic, ceramic on plastic, ceramic on ceramic, and metal on metal. Let's now take a closer look at the complete journey of knee replacement surgery. On day 1, the patient undergoes diagnostic tests such as X-rays and MRIs. Day 2 involves hospital admission and pre-op test. Day 3 is reserved for the surgery. Day 4 and 5 are focused on recovery and post-surgery care. And on day 6, the patient is discharged. For international patients, the total stay in India is typically 2 to 3 weeks. Domestic patients can usually return home shortly after the discharge. The post-surgery care at home includes icing, wound care, exercise, physiotherapy, and a healthy diet. While understanding the medical procedure is essential, it's equally important to consider the financial aspects as well. The pre-surgery cost will include some expenses for the diagnostic test. The cost of knee replacement surgery varies depending on the type of surgery you choose. The post-surgery cost will include the physiotherapy and the medication expenses. Apart from these expenses, there is also logistic cost, which will include the food, accommodation, travel, and other expense. The key factors that affect the cost of knee replacement surgery involves the type of implant, surgical procedure, city, hospital, the surgeon's expertise, and the duration of hospital stay. Vaidam helps you to connect to the top doctors for knee replacement in India and the top hospitals for knee replacement in India as well. Vaidam simplifies your treatment journey with this wide range of services.
हमने हॉस्पिटल में एडमिट हुई और वहाँ पर घुटनों का दर्द का इलाज हुआ। मेरे डॉक्टर थे विवेक महाजन, उन्होंने मुझे बहुत अच्छा से इलाज किया और मुझे वहाँ के नर्स भी बहुत अच्छे थे, जो स्टाफ थे वहाँ के बहुत अच्छे थे।
We at Vaidam serve patients in the top 9 destinations of the world, and we focus on not only one but various different treatment specialities as well. Vaidam has successfully assisted over 100,000 plus patients. For any medical assistance or to start your treatment journey, contact Vaidam Health